This is a question I get all the time from my patients. Do you have to remove tooth structure? How much do you have to remove? So it really depends. I know there's a really big push for these no prep veneers or minimal prep veneers, and that does work in a lot of situations, but I'll say not in most situations. There are some situations where you just cannot have minimal prep veneers. And that's because if you don't take off the tooth structure, you don't have enough room for the porcelain. So it gets either super thin up at the top where your gum line is, and it usually breaks off there. I have a lot of patients that get, no prep veneers or minimal prep veneers, and they come in and they're like, I just got these done. Why are they all broken? And it's because there's no space for them. The other thing that can happen is your gum line gets really irritated. It traps a lot of bacteria because the restoration is not flush with your tooth. There's no space for it. It's just laying on top of your tooth. So you get a lot of bacteria that build up there, and then that leads to problems with inflammation in your gums and potentially bone loss and all of that. So there is certain cases where it works for, but it's not the most common. Now, you do have to remove tooth structure generally for a veneer prep. It's much more conservative than a crown, so it's usually just the front surface, maybe a little bit on the back, just depending on the case, and how the tooth is positioned in the mouth. So generally speaking, when you take off tooth structure, it's about 1 millimeter or less of tooth structure that you take off. So although it's not that much, it is an irreversible procedure, so it's not like you could walk around with nothing on your tooth, but it's not like the teeth that you see on the internet where they're just dwindled down to nothing and they look like shark teeth. That is a rare case, and that usually has to do with if you have decay or if you have crowns and they're being redone for the 4th or 5th time. Generally speaking, that is not what happens when you have natural teeth and you're just putting some veneers on them. But yes, it is best to take off a little bit of tooth structure in most of the cases so that you can make sure you get a good fit and a restoration that looks thin and not bulky and very natural and lifelike. So if you have restorations, let's say you have crowns or veneers and you notice that your gum tissue is always really puffy, or it's always bleeding, or you see some fractures in them, then make sure that you're getting that checked out by your dentist.